Hello, everyone. Welcome back. Good morning. I'm Steve.
And I'm Scott.
And together we're Backyard Musings. We are in Apple Valley, but it's blazing hot, so we're inside. Plus, it's windy. Well, let's get the Santa Ana winds in the afternoon.
Yeah, very windy, very hot. And we are talking science and technology, and I'm just giving you a warning. This may not be a really, really hot topic.
It's not a popular topic.
Yeah.
French fries raise type 2 diabetes risk, but whole grains may help reduce it, according to a large Harvard study. A new study from the Harvard T.H. Chan School of Public Health has found that eating French fries is linked to a higher likelihood of developing type 2 diabetes, and we'll just call that T2D from now on. Other potato dishes such as baked, boiled, or mashed varieties do not show the same connection. Researchers also discovered that replacing potatoes of any kind with whole grains could help lower the risk of T2D. The findings were recently published on August 6, 2025 in the BMJ. Would you like to know more?
Okay, so it sounds to me like they're going to be messing with the fry.
I know, man. It's going to be hard for me to switch it up.
Like mock meat, they're going to be mock fries.
Well, I like sweet potato fries.
Oh, no. That shouldn't even be. Sweet potato and fries should not even be in the same.
Mm-hmm.
No. Okay. Anyway, scientists explained that earlier research suggested a possible relationship between potato consumption and T2D, but the results were often inconsistent. Many of those studies did not carefully examine how potatoes were prepared or what happened when other foods were eaten in their place. Quote, our study offers deeper, more comprehensive insights by looking at the different types of potatoes, tracking diet over decades, and exploring the effects of swapping potatoes for other foods. That's according to lead author Syed Mohammed Musavi, postdoctoral research fellow in the Department of Nutrition. Quote, we're shifting the conversation from are potatoes good or bad to a more nuanced and useful question. How are they prepared and what might we eat instead?
Valid questions. The researchers examined the diets and diabetes outcomes of 205,000 men and women enrolled in the Nurses' Health Study, Nurses' Health Study 2, and Health Professionals Follow-Up Study for more than 30 years. So these are medical professionals who are answering these questions. For more than 30 years, participants regularly responded to dietary questionnaires detailing the frequency with which they consume certain foods, including French fries, baked, boiled, or mashed potatoes, and whole grains. They also reported on new health diagnoses, including T2D, and various other health, lifestyle, and demographic factors, which the researchers controlled for. Over the course of the study period, 22,300 participants reported that they developed T2D. So that's more than 10%.
Yeah.
Slightly more than 10%.
That's a lot.
Yeah.
The study found that 3 servings weekly of French fries increased the risk of developing T2D by 20%. Baked, boiled, and mashed potatoes were not significantly associated with T2D risk. The researchers calculated, however, that eating whole grains, such as whole grain pasta, bread, or farro, I don't know what that is, in place of baked, boiled, or mashed potatoes could reduce the risk of T2D by 4%. Replacing French fries with whole grains could bring T2D risk down by 19%. That's pretty high number. Even swapping refined grains for French fries was estimated to lower T2D risk. So what are they talking about? They're talking about making a French fry out of pasta?
Maybe.
Oh.
Or soy. I wonder if how French fries, like you buy them at the grocery store and you put them in like the oven. I wonder if it's better if you cut up the fries yourself and bake them yourself rather than being processed. Peel the potato and
make your own fries.
Yeah, I wonder if that would be a little bit better. Suppose if you used olive oil instead of, seed oil.
Yeah, have you ever had a boiled potato?
A boiled? Yeah, like mashed potatoes where you boil them up? Yeah.
Well, no, I don't know. boiled, like just a boiled potato, almost like a
You trying to stump the chump on this one?
stewed potato.
Stewed potato.
Like a potato that's been in stew or
Yeah. Like we do meat stew a lot. It's like comfort food. Yeah, there's potatoes and carrots in there and onions.
Okay.
Yeah.
All right.
So the researchers complemented their study with a novel meta-analytic approach to estimate how swapping potatoes for whole grains would affect the risk of T2D using data from previously published cohort studies.
This involved two separate meta-analyses, one based on data from 13 cohorts examining potato intake and the other from 11 cohorts on whole grain intake, each encompassing over 500,000 participants. That's a big study, and 43,000 T2D diagnoses across 4 continents. The results were closely consistent with those of new study.
Quote, the public health message here is simple and powerful. Small changes in our daily diet can have an important impact on risk of type 2 diabetes. Limiting potatoes, especially limiting French fries, and choosing healthy whole grain sources of carbohydrate could help lower the risk of type 2 diabetes across the whole population, said corresponding author Walter Willett, professor of epidemiology and nutrition.
Quote, for policymakers, our findings highlight the need to move beyond broad food categories and pay closer attention to how foods are prepared and what they're replacing. Not all carbs or even all potatoes are created equal, and that distinction is crucial when it comes to shaping effective daily or dietary guidelines, unquote.
Yep.
Okay,
folks, thanks for joining us. We'll talk to you in the afternoon.
Let us know what you feel about those boiled potatoes and those pasta fries. Take care, everyone. Thanks.
Yeah.